Hey everybody, I just wanted to give you a quick update on where we are with our COVID response on this particularly busy and historic week, particularly as it relates to the access now and distribution of the vaccine. But I want to just begin with a sober reminder of where we are in terms of average number of daily cases, approaching roughly 40,000, 39,810 is the 7-day average total number of new cases of COVID-19 positive Californians. Just yesterday, we reported over 40,000, 41,012 individuals. Let's put this again in perspective, looking at this chart going back to April. We're now at 11.8% positivity. Our positivity rate, that is, in the state of California over the last 14-day period is now 11.8%. The average number of daily tests is now over 300,000. That's an encouraging sign. We're getting close to having tested almost 30 million Californians, averaging now roughly 310,000 daily tests. We still have to see those numbers grow, and we're working hard to make testing more available and more timely in terms of results. Take a look at the positivity rate over the last 14 days, that 11.8%. Just look where we were 2 weeks ago at 7.6%. It gives you a sense of the rate of growth in terms of the transmission of this disease. 70% increase in our hospitalizations over the last 14 days, now over 16,000 Californians that are COVID positive in our hospital system. I'll talk more about that in just a moment. You can see as well the ICU admissions, 58% increase over the last 14 days, now over 3,400 Californians in our ICUs. And the ICU and hospitalization rates over a 2-week period, I put this slide up so you can really absorb and get a sense of where we really are in terms of the total number of average cases, but also what's happened to our hospitals and what's happening in our ICUs. 117% increase as you look at the 7-day average number of cases over a 2-week period. You can see from 9,453 COVID positive patients in our hospitals, 70% increase again over just a 2-week period to now over 16,019 COVID plus hospitalized patients. ICUs, similarly, 58% increase, 2,182, now to 3,447. You can see what happens just over a period of days and weeks, not months. So I want to be I'm right here reminding you of where we are in the midst of this pandemic with a sense of urgency, of focus in terms of what you can do, what we can do together to mitigate this spread and to bend this curve at this critical juncture. And here's why this is sober. Take a look at this. 1 month ago today, we were at 61 deaths, at least in terms of the date reported, which is yesterday. 61 deaths on November 17th. 300 deaths we reported a month later. 2,578 people have lost their lives just in the last 2 weeks. A reminder of how deadly this pandemic is, how deadly this disease is, and how we are battling our way through the peak of this third wave, and how we still have a lot of work to do over the course of the next number of weeks. Take a look here at what I mean by that. Current ICU capacity in the state down to 2.1% statewide. Take a look at San Joaquin Valley, 0%. Down in Southern California, 0%. You saw some headlines in the last 24 hours just down in Southern California. The Bay Area now formally and officially dropping below 15% ICU capacity, now moving into this new regional stay-at-home order, now representing 98% of the state. San Joaquin Valley, Southern California, the greater Sacramento area, of course the Bay Area specifically, now under the regional stay-at-home order because of the lack of availability in our ICUs. I'll just remind you, as it relates to the ICUs, when you see 0%, that doesn't mean there's no capacity, no one's allowed into an ICU. It means we're now in our surge phase, which is about 20% additional capacity that we can make available through the ICU system. So I don't want people to be alarmed by that, except I do want to raise the alarm bell about what we all must do individually and collectively to address this rate of growth. And we have the capacity to do a lot to do that. But again, ICU capacity now down to 2.1% statewide. When it hits that 0%, we'll be in that surge phase as we already are in San Joaquin Valley and in Southern California. I'll remind folks of something very familiar. Those of you who have watched our formal press conferences on Monday and Tuesdays. This is the alternative care sites that we've already set up in the state. Imperial Valley College is already set up. Sacramento, the Sleep Train Arena is already set up, actually bringing COVID positive patients into that arena. We also opened this week, just in the last few days, Porterville Developmental Center and Fairview Developmental Center, allowing us to decompress our hospital system, make more space available, and allow for more acute patients in those acute care facilities, these alternative care sites, allowing us that capacity. Reminder, we have a couple thousand rooms that are available in the alternative care sites, and we will take them off what we refer to as the warm status and bring them online, as these 4 have in the last few weeks, 2 this week, a few others over the last few weeks, be making them available throughout the state of California. These have been pre-positioned, strategically placed in areas that we anticipate need. Staffing is, of course, our biggest need. It's the number one issue that we're facing in this state. We continue to work to provide more staff, more support for our counties, our local health officers, our districts that reliant on state support. We're also looking to get federal support. So you can see just the staff we've already deployed at 69 facilities in 22 different counties, 539 state staff. We have outstanding requests in the Department of Defense, and we have outstanding requests in Health and Human Services. I've been dialing a lot to talk to Secretary of HHS to get an extension, for example, on our DMAT team that are supposed to be, they're supposed to be sent back to the federal jurisdiction on the 24th of this month. It's an example of what those specific requests look like. I'll talk more about that on Monday and Tuesday and Wednesday next week. Health Corps is a big part of our staffing strategy. 143 facilities statewide have been supported by close to 3,000 shifts for Health Corps members, and they're in their skilled nursing facilities, our veterans homes, as well as at the Sleep Train Arena themselves. We want to encourage those that have just recently retired, people that have a unique skill or expertise. Their license may need to be upgraded or updated. Go to the COVID-19.ca.gov website, COVID-19.ca.gov website. Learn how you can participate at this critical juncture, critical moment, and provide your skills, your expertise to help us out in terms of our staffing challenges, particularly as we look out over the next number of weeks. Here was the good news, and when I said historic, it's sort of that bookmark of the reality, this light at the end of the tunnel, but the sober reality that we're still, again, in the tunnel. But even brighter light, and I'll get to that in a moment in terms of what's happened over the last 24 hours. But here's what happened at the beginning of the week. I'll remind you of what Pfizer has provided the state of California, at least has committed to the state of California, 560,625 doses. It was higher. We had anticipated we would be receiving a second allocation on top of the 327,600 doses that were already delivered to now 117 specific sites statewide. That's what occurred this week, Monday, Tuesday, Wednesday, and yesterday. We were hoping to get 393,000 doses allocated to the state in that second allocation, but we were told yesterday by CDC, HHS, that they're cutting that by 40%. So unfortunately, it went from 393,000 down to 233,025 that is anticipated as our second allocation. And so that's unfortunate, but it's good news nonetheless. The irony of that, and it's been well considered, or rather well reported, and we talked to Pfizer ourselves directly, that they claim they have more vaccines, but are not getting the authorization from the federal government for the distribution. So there's been a point of frustration, friction, to be candid with you. It's been expressed by many, many governors all across the country, regardless of even political party. I'm always here, not with a clenched fist in terms of these issues, but an open hand to understand what we can do to address that disconnect between what Pfizer is saying and what the CDC and HHS is saying. We have calls in, not just to Pfizer, where we got calls back, but to the administration to get more clarity on that, and we'll update you in real time. I won't wait till Monday. If we get more information on this in real time, I'll make sure we update folks. So that's the second phase allocation, 560,000 Pfizer doses. We were able to get out. We're going to get more information. I want to make sure they're perfectly accurate. And the public, press, others asked for specific data as it relates to doses that have been administered, meaning shots in the arm. You'll see here, day one, we were able to accomplish some 3,278 doses that were injected. We are going to update that number day 2 and 3. We will provide that as those new numbers come in. We're putting together a database. We want to make sure it's really accurate. Day 1 numbers we are confident are accurate. And day 2 and 3 we're putting together and present those as soon as I have them. But here's the brighter light at the end of the tunnel I was referring to, and that's the anticipation that the FDA is going to quickly approve for emergency use the Moderna vaccine. I remind everybody the Pfizer vaccine's a vaccine that needs to be in a freezer versus Moderna, which needs to be in a refrigerator. More folks have access to refrigerators, particularly in rural parts of the state, more remote parts of the state, than they do freezers. That's just an easy way of sort of describing the ultra-low storage versus just the cold storage, which is the distinction between the two vaccines in terms of the distribution. There's also some other distinctions in terms of the vaccines as it relates not just to its efficacy and safety, but also in terms of other aspects that distinguish Moderna from Pfizer. That's for another day, but want to remind you that we are committed each and every day to your safety and really monitoring the efficacy of these drugs. And it's not that we don't take other people's word. We trust, but forgive me, I'm in Ronald Reagan's old office here. We verify, and that is the creation of this Western States Scientific Safety Review Work Group, 11 California members, 6 members from 3 other states, 17 members. They unanimously supported the efficacy of and safety of the Pfizer vaccine. They are reviewing the Moderna data, and immediately, as soon as we get the final FDA approval, they'll review that additional data and make a determination so that we can quickly distribute 672,600 anticipated doses of the Moderna vaccine that we anticipate as early as next week. 672,000, that's in addition to the Pfizer vaccines that we just updated. So Moderna, again, easier to store, and that makes it easier to distribute. From a logistics perspective, makes it much more available to those in parts of the state that are under-resourced traditionally in terms of access and availability. A critical component of the work that our Citizens Vaccine Advisory Committee is doing. Remember, we have a guidelines working group that advises the Citizens Advisory Committee. They met yesterday, Wednesday, in a public setting. It's been reported. I encourage you, if you want to tune into these public discussions about distribution of vaccine, they were discussing the phase 1B allocations. These are the allocations. Once we utilize roughly 2.4 to 3 million doses for healthcare workers and folks in assisted living and skilled nursing facilities, these would be the next allocations. Food service workers, teachers, they discussed at length yesterday who was in that group. I encourage you again to go to the COVID-19.ca.gov website to learn more about that. But progress is being made in terms of identifying and prioritizing phase 1B allocations. And so that process is in real time. It's very public. Again, I encourage you to go and learn more about it. The COVID-19.ca.gov website. Look forward to keeping you updated in real time, and look forward to being back more formally on Monday, updating you comprehensively as it relates to the status of this pandemic and our efforts to mitigate the spread and ultimately to eliminate this virus. Take care, everybody.